Welcome to Vertical Movement PT. I'm Dr. Cindy, physical therapist. Today we are going to go over general knee pain, and this video can be used to help prevent knee pain or to help address your knee issues if you already have knee pain. So go ahead and put on something comfy, get your mind in the game, and let's get started. So this routine is great to help jumpstart your rehab process if you are suffering from knee pain, but nothing replaces actually going to see your local physical therapist because there are a multitude of reasons of why you could have knee pain. It could be the IT band syndrome, where your IT band causes friction against the lateral epicondyle of your femur. It could be patellar compression syndrome, where the patella is causing compression on your knee joint. It could also be patellar tendonitis, where the tendon is inflamed. It could also be osteoarthritis, which is just general wear and tear and inflammation in your knee over time as we age. So go see your local physical therapist so that you can get the most detailed treatment plan that's specific to you. But okay, let's go ahead and get started with our routine. Okay, first, we are going to start with a soft tissue mobilization to get the tissue moving. And one of the muscles that tends to contribute to knee pain is the quadriceps muscle. And that's actually a general term for 4 muscles. And the quadriceps muscle is consisted of the rectus femoris. Underneath that is the vastus intermedius. On the side of that is the vastus lateralis. And inside is the vastus medialis. So that's why it's called the quadriceps for 4. And what you're going to do when you do the soft tissue massage, you want to think about that there are 4 different muscles here. And the idea is to go ahead and try to separate those muscles, because sometimes the fascia and the soft tissue of that muscle can just kind of get adhesive and get stuck to each other. So right now, I'm going to kind of doing something called a tenting. I'm like lifting up the soft tissue off of my femur, off of the bone. And then I kind of feel the groove here. It's very difficult to feel it, so just a general location, but I kind of feel the groove here of the separation of the rectus femoris and the vastus lateralis. So as you can see, I'm doing like the tenting technique, and then going on the inside, and it's the same thing as what I did on the outside, doing that tenting to the vastus medialis. You might find that there's one muscle that's tighter than another, and you can spend more time working on that. You could also do the technique of putting your hand into a fist, and this one can be kind of painful. So a good pain, like I like to call it, is when you know it's doing good. But if you're getting severe sharp pain, or you get bruising after you do this soft tissue mobilization, I would say that you're going a little too rough, so lighten up. So you can go ahead and you can add some lotion, but I actually like doing my mobilizations without lotion because I feel like I get a better grip of the tissue and I can do a better job of getting things mobilized. But the quadriceps muscle, all 4 of those muscles of the quadriceps muscle, it connects to the top of the patella, which is that little bone here on the top of the knee. So you just kind of want to go all the way to the top of the knee. And if you want to get all the way from the start, my shorts are kind of getting in the way, but you kind of have that idea. Okay? And after you do that for a few minutes and you feel like things are getting a bit more loose, you can go ahead and move on to the IT band right here. And the IT band, it's a fascia, and this also contributes to knee pain. This is in charge of stabilizing the outside of our knee. And a lot of times runners, long distance runners or hikers, they tend to get their IT band to get inflamed. So what you're going to do, you're going to go ahead and grab around the IT band And the same thing, you're tenting it. You're kind of lifting it off, almost kind of trying to peel it off, which sounds really gross. There you go. And you can go ahead and even grab it and move it up and down. Sometimes people who have really bad IT band syndrome, you can see the definition of the IT band. You can see the line here. There you go. And the IT band, it connects to the external part of the iliac crest. It's kind of like right over. Goes up pretty high. And it connects down over here to the lateral condyle of the tibia. So if you have IT band syndrome, you'll feel the pain on the outside of your knee. Okay. And make sure to get all the way to the connection. Okay. And you can also get the mighty fist and do the same thing. You could add lotion if you can't bear the friction, but if you can, I find it's always better to just do it on bare skin. All right. This you can do for about like 1 minute to 5 minutes until you feel like things loosen up quite a bit. You could also use a foam roller to help roll out the tissues. Okay, now we're gonna go ahead and move on to our stretching portion. Just like how we broke up the soft tissue of the quadricep muscle and the IT band, we're gonna do the same thing, mobilizing those muscles, but with stretching. So doing the quadricep stretch, go ahead and grab something for balance. The last thing you need to do is fall. And go ahead and grab behind, if it's your left knee, go ahead and grab your left foot. What you're going to do, you're going to make sure that your leg is straight and aligned with, whoa, almost fell, is straight and aligned with your body. And you don't want it to be forward like this because you're really not stretching anything. Okay. And if this stretch is too hard for you, you can go ahead and put it up on a chair. All right, and let's go ahead and switch to the other side. So even though, let's say, you only have pain on your left knee, I'm all about doing the exercises and stretching on both sides. Okay, there you go. And if you want a little extra oomph, you can go ahead and contract your leg by pushing it into your hand, and that's activating the quadricep muscle. Do that for 5 seconds and then relax, and then pull your foot closer to your bum, and that will give you a deeper stretch of your quadricep muscle. Now we're going to go ahead and move on to stretching out our hip flexor muscles as well as our calf here. So doing a lunge, and you're going to go ahead and lean forward. So this is stretching my calf on my left leg here, as well as mobilizing my ankle on my left foot. Usually the knee isn't the reason why you have the knee pain. It's because of the hip and because of the ankle. They're the ones that have the impairments, and it causes that. The knee takes the blame. Okay, go ahead and switch. Okay, and lunging forward. So now we're stretching out the right calf, the right ankle, as well as the right hip flexor right over here. And leaning into that stretch. Just make sure your body is nice and straight and that you're not leaning forward, because you won't really feel the stretch if you lean forward. Okay, so those are the 2 stretches that you can do to help relieve your knee pain. You can do the stretches up to 3 times each, 1 to 3 times for 30-second holds. Okay, now we're going to move on to our strengthening portion. So go ahead and grab a pillow if you need a support. And we're going to work on strengthening the gluteus medius. And that's the muscle that supports your hip. That's so important. And a lot of times knee pains happen, knee pain happens because you have a weak gluteus medius. So the first muscle strengthening exercise we're going to do is something called the clams, and you're pretty much going to make a clam with your knee, just like this. Go ahead and you're going to bend your knee slightly. What you're going to do, you're going to open your knee, keep your ankles together, and close your knee. We're going to do 10 of these. 2, 3, good. And you just want to make sure that you're activating the glute muscle, the gluteus medius right here. If you're not quite sure where that is, find the bone here on the side of your hip and just go a little bit behind that. You want to make sure that you're not activating too much of the TFL muscle, the tensor fasciae latae, because that muscle tends to be overcompensation muscle, that you use that instead of using your gluteus medius. Okay, let's go ahead and switch to the other side, because I'm all about being even and not lopsided. Even though most of us are all lopsided in some parts of our body. Okay, and the same thing. Using that gluteus medius right over here. If you find that you're overcompensating and using that tensor fasciae latae, go ahead. You can straighten your thighs a little bit more to help emphasize that gluteus medius. Go ahead and even activate your core so you can learn how to use both of the muscles together, because we don't just use one muscle at a time, but we have to learn how to activate all of our muscles throughout our body. Okay, let's do about 2 more. Okay, so next we are going to do something called the hip abduction. So back to the other side. And this also is working the gluteus medius. And yep, let's still use the pillow here. Need a little bit of space. Okay, so you're gonna bend the bottom leg. We're working the left gluteus medius right now with your, oh, boo, the ottoman is in the way. You're gonna go ahead and lift your leg straight up and down. And the same idea, you wanna use that gluteus medius muscle. Very good. Make sure that your leg isn't going forward like this and you're actually engaging the hip flexor muscles, but you want it to be nice and straight here with your body, or even a little bit more behind you. You could also turn your foot out, externally rotate it, so just like this, to help emphasize using that gluteus medius muscle. Very nice. Okay, let's go ahead and do about like 4 more. I think I did about like 1,000. Okay. All right, let's go ahead and move on to the other side. Say no to being lopsided. Should make a bumper sticker that says that. Okay, so bottom leg bent, top leg straight. Ooh, risking some nice, risking, is that a word? Rubbing against some plants. So leg nice and straight here. And the same idea, you want it to be right along with your body, not too forward. And you can externally rotate your foot to emphasize that gluteus medius. Okay. I'm petting my plant in the process doing this. Okay, go ahead and do about like 2 more. Good plant, good plant. Okay, so now we're gonna go ahead and move to doing something called bridges. And that helps strengthen the gluteus maximus. And that's the big muscle in the back that everyone recognizes. But what you're gonna do, you can lay down on a pillow, but I actually prefer no pillows because I feel like it lifts your head up. But if you absolutely need it for comfort, go ahead. Hands on the ground for support, and you're gonna go ahead and lift your glutes up off of the mat and down. And you really wanna focus on activating your gluteus maximus and not so much using your low back muscles to extend your hips here. That's a common problem for low back pain, by the way. There you go. You should also feel, you could feel a nice stretch here in your hip flexors if you tend to be tight there. And let's go ahead and do about 4 more. You want to make sure with all these strengthening exercises to do about 10 to 15. Okay, very good. All right, so we're gonna move on to donkey kicks. And what you're gonna use is a stool or maybe the back of the sofa or a countertop. And for this one, it's strengthening the gluteus maximus. So you're gonna go ahead and lean forward on your countertop or your stool and working the left gluteus maximus, engaging your core so it's nice and tight. You're gonna go ahead and like a donkey, kick up. I don't think I've ever seen a donkey kick before. There you go. And you just wanna make sure you're not extending from your low back. You don't wanna do this. You wanna make sure that you're getting the movement straight from your glutes, from your hip. Okay, let's do about 2 more. Okay, let's do the other side. Leaning forward here. So using my right leg and stabilizing with my left leg here. Go ahead and kick straight up. Focusing on that gluteus maximus. A lot of times, hip weakness is what contributes to knee pain because our hips aren't doing a good job stabilizing our knee. And then our knee takes the payment. Poor knee. Okay, go ahead and do 1 more. Maybe 1 more just for good measure. Oh. All right. So, get rid of your stool. Next, we're gonna go ahead and the last part of this routine is working on ankle stabilization. Because a lot of times knee pain is contributed to an ankle being too stiff, where it's causing the knee to have to take the slack of the ankle not moving and it has to do the movement. Or it could be because the ankle isn't stable. So I like to do a little ankle stability to help with knee pain. So you can do a single leg balance, just like this. And you want to hold that for about 30 seconds. But if that's too easy, I like to do something called single leg balance stars. And work with me here. I actually have unstable ankles. You know what I mean. So you're gonna go ahead and draw a star. And you're gonna do that about 5 times without falling. And this is if you feel like you can do this safely. If you can't, just do the single leg balance. All right, very nice. Let's do the other side. Okay. And if you feel like drawing the stars is just a little too much, you can go ahead and do the single leg balance. Maybe like grab a stool to help support you just in case. And you can close your eyes. And as you can see here, it gets a little bit wobbly. But you can also just go back to the stars. And doing 5 of these, okay? Just remember, you are a star. And last one. Oh man, I'm getting sweaty. Okay, and there you have it. So now you're gonna go ahead and repeat that whole routine for another 2 times for a total of 3 rounds, okay? So let's go ahead and continue with the routine. Okay, so let's go ahead. We're gonna do the clams 10 times. Making sure you're activating that gluteus medius here. Good. Let's go ahead and change sides. Remember, gluteus medius. You want to feel it on the back part here. Very good. Okay. And let's switch sides. For the hip abduction. And for all of you guys at home, you don't have to flop back and forth like me. You could just turn around. But I don't want to scar you guys and have you look at my backside. Okay. Now hip abduction, leg straight. Have it straight with your body. You can externally rotate that foot. You want to feel it right over here in that gluteus medius. You guys are going to have such strong butts after this. Stabilizing your knee with your strong butts. Saving the world one day at a time with your strong butt. Okay, let's switch over. Leg straight. You can externally rotate that foot. And back to petting the glute. Okay. Feel that right over here in the gluteus medius. Let's do about 4 more. Okay, and last one. Very nice. Okay, let's go ahead and let's move on to doing our bridge. Let's turn around and do the bridge the opposite direction now. Change it up. So this is how you do it with the pillow. For those of you who tend to have forward heads that it's just so painful for your neck to be flat down on the ground, you can have a very shallow pillow. And you're gonna go ahead and go up. But as you can see, it adds a little bit more pressure on your neck. So that's why I don't advise the pillow, but it's just for those people who absolutely can't lay down flat with that one. Okay, so now we're working on the gluteus maximus, the super butt muscle. Just remember, you don't want to be using your low back muscle, but really engaging that gluteus maximus. And up, down. Good stretch in the hip flexors. Okay, and one more. All right. So now let's go ahead and move on to donkey kicks. So grab your stool. Leaning forward. Kicking up. Just really focusing on driving that leg up. Core nice and tight. Giving my other plant some love. Okay, 3 more. Make sure your core is stabilized. And then, like drawing your belly button into your spine. Okie dokie, let's do the other side. Doing the right gluteus maximus. Total of 10. Okay, very good. And then now let's go ahead and do our ankle stability, single leg balance with the star. And if you can't do the star, don't forget, you could just balance on one leg because that's hard enough as it is. Whoa. Do about 5 of these stars. And tell yourself, I'm a star. I'm a star. Might as well boost your confidence while you're exercising. Okay, and let's do the other side. The left ankle to get that nice and stable. 5 of these, okay? And if you're feeling really adventurous, you could do the stars with your eyes closed. Just make sure you don't fall. Okay, and last one. Okay, you survived 2 rounds of that routine. Let's go on to our last round. Okay, back to doing the clams. Get into position, and let's do 10 of these. Put your hand on the gluteus medius, just so you can feel that muscle activating. Let's do about 4 more. Ooh, my butt's kind of shaky now. Good. Clams are great to help with knee stability, especially if you tend to be someone that has their knees that cave in. Having a strong gluteus medius helps so that your knee doesn't buckle in inwards. Hand right here on the gluteus medius. Okay, let's do about 4 more. You guys are almost done. Just hang in there. Okay, now let's go ahead and do the hip abduction. You will all have glorious butts at the end of this. Glorious strong butts. Okay, top leg, the left leg nice and straight for hip abduction. Activating gluteus medius. You're probably gonna have bad dreams thinking about the word gluteus medius. Don't have those dreams. It's a good thing to have a strong gluteus medius. Okay, let's do about 3 more. All right, let's switch to the other side. You guys are awesome. We're almost done. Okay. I like to bend my bottom leg because it helps me balance. If I have the bottom leg straight, I tend to topple over forward or backwards, so bend it a little bit. Okay, let's go ahead and do about 5 more. You can externally rotate that leg. You feel the emphasis more on that muscle. Okay, last one. Okay, and then now let's move on to bridges to work that gluteus maximus. And I'm gonna do it without the pillow. I feel like that feels nicer on my neck. Okay, and go ahead. And lift up and down. Really concentrating to engage that gluteus maximus muscle. Because it's true, if you think about what muscles you want to use when you exercise, you are more likely to engage that muscle. Versus if you exercise mindlessly and not focused on what you're trying to activate, then it's not really an efficient workout. A lot of times people tend to use and activate the wrong muscles. All right, let's do about 2 more. And down. Okay, so let's do the donkey kicks. Get my ears going. That means I'm working out. Yeah, good job. Okay, so go ahead and get the stool. Lean forward for the donkey kick. Activating that gluteus maximus. Here we go. Make sure not to extend in your lower back, okay? Go ahead and do 3 more. Okie dokie. And let's do the other side. Just make sure you also don't lock the knee that you're standing on. You want to have a slight knee bend. Okay, let's do about 4 more. Okie doke. Last exercise. And that's going to be our single leg balance to help with our ankle stability. Start on our right leg. Whoa. Whoa. And let's go ahead and do the star. Very nice. Any songs with stars? Twinkle, twinkle, little star. Twinkle, twinkle. Sing to yourself. Okay, let's do one more. Okay, now our left leg for our grand finale. So if you're feeling like you want to challenge yourself, go ahead, try closing your eyes. I don't think I can do it very well. Yeah, do you see that ankle instability? This is a great way to get that ankle stable. And just a reminder, if you feel like you get any pain with any of these exercises, go ahead and stop doing them because you shouldn't feel any pain. And I highly recommend going to see your local physical therapist to help guide you on how to do these exercises. Congrats, you did it. We are all done. I recommend doing this routine 2 times a week for 6 weeks because it takes 6 weeks to actually build muscle. And at the end of the 6 weeks, I'm sure you will notice a difference in your knee stability and a decrease in your knee pain. If you like this video and you want to watch more videos, go ahead and subscribe to my channel, Vertical Movement PT, and I am looking forward to seeing you next time.